Okay. Sorry, I know it's weird. Thank you.
God values compassion towards others, and the nursing profession is all about compassion. In Luke 10:30 through 35, Jesus was beaten and left in the street by merciless robbers. A man came along, dressed his wounds, took him to an inn to heal. This man was known as the Good Samaritan. All nurses aspire to be just like him. I'm currently studying to be a nurse. I've taken science classes to learn about body systems and chemical therapy. I've also taken care of my chronically ill mother for the past 2 years, which has taught me patience, as well as putting another person's needs before my own. Nursing is a valuable profession that reflects God's love by caring for those in all stages of their life. There are many ways in which nurses support God's agenda. They demonstrate a respect for human life, even under the most difficult of circumstances. Abortion and euthanasia are two issues in which Christian nurses are able to use their profession to achieve a faith-based outcome. Nursing is all about compassion for the sick, injured, and mentally unstable. Not all patients are seen by society as worthy of medical care, but Christian nurses demonstrate God's mercy and forgiveness for all by treating those who may not have a close relationship with Jesus. God values respect for human life. According to the American Nursing Association, a fundamental principle that underlies all nursing practice is respect for the inherent worth, dignity, and values of all persons in all professional relationships. Nurses deal with all different types of people and all different levels of illness. They face many ethical dilemmas during the course of their careers. While there are 115,000 abortions performed worldwide, only 7% of those are performed on rape victims, incest victims, and victims of health concerns. Another ethical dilemma facing many nurses is the issue of assisted suicide. In a survey of 852 nurses, 17% reported that they have received requests to perform assisted suicide by a patient or a patient's family member. God values our compassion for others. The Bible states, "Finally, all of you live in harmony with one another, be sympathetic, love as brothers, be compassionate and humble." It is difficult to take care of people when they are at their worst, sick, injured, or unstable or inconsolable. The most important job of a nurse is to live Christian faith every day. Nurses care for the terminally ill patients, even though their chances of recovery may be minimal. Patients with late-stage cancer, for example, are provided for as thoroughly as patients with lesser issues. Some nurses have even been known to develop compassion fatigue. This develops when a nurse experiences emotional distress due to watching their patient battle illness. God values our attempts to communicate His gospel of forgiveness and redemption to those who do not know Him. The Bible states, "Let the wicked abandon his way, let him forsake his thoughts, let him turn to Yahweh, for He will have mercy, for God is generous and forgiving." It is not a nurse's place to judge, but to demonstrate God's love for all. Nurses are ethically bound to provide care for patients no matter how they have contracted their illness. If an individual tests positive for HIV, even after sharing a needle or having unprotected sex, a nurse must care for them regardless of their feelings on substance abuse or sex outside of marriage. Nurses keep lifestyle choices and details of illness confidential. This helps the patient learn to trust them. Therefore, they are representatives of God on earth by teaching faith and showing that even knowledge of sin or weakness does not mean a person is not worthy of God's love. In conclusion, nursing is a valuable profession because nurses demonstrate God's value for human life. They show compassion for others during their time of need, and they demonstrate God's mercy even to those who do not know Him. As a result of the curse Adam and Eve, sickness, illness, and disease do exist, but nurses battle this every day. Thank you.